Fatty liver symptoms. Did you know that non-alcoholic fatty liver disease affects 25% of the entire global population? In this video, we'll be going over 12 signs you may have fatty liver disease. Number 1. Unexplained weight gain. Unexplained weight gain, especially around the abdomen, can also be a sign of fatty liver disease. Fatty liver impacts the body's metabolic processes, impairing the liver's ability to regulate fat. When fat accumulates in your liver, it affects how the body handles the fat you consume and results in excess fat storage, particularly in your belly. This is often coupled with a noticeable increase in waist size, which may seem disproportionate to any changes in diet or exercise. It can be especially frustrating for those who try to maintain a healthy lifestyle, but still find themselves gaining weight without reason. Belly fat, in particular, is a known indicator of liver dysfunction, and it's essential to consider this symptom as part of a broader picture of liver health. If you find yourself gaining weight despite efforts to maintain a balanced lifestyle, it may be time to consider fatty liver disease as a potential factor. Number 2. Upper right abdominal pain. Your liver is located in the upper right side of your abdomen, so when it becomes inflamed or enlarged, it can cause discomfort or pain in this area. This pain is often described as dull and persistent, although it can become sharp or intense after eating fatty or large meals. As your liver swells due to fat accumulation, it stretches the capsule that surrounds it, leading to a sensation of pressure or fullness. While many people may dismiss this as a simple stomach ache, prolonged or frequent pain in the upper right abdomen is a significant symptom that should not be ignored. If you find that the pain persists or worsens, or if it is coupled with other symptoms like nausea or fatigue, it's important to get your liver health checked by a healthcare professional to rule out fatty liver disease or other related conditions. Number 3. Dark urine. A subtle but crucial symptom of fatty liver disease is dark-colored urine. Your liver is responsible for processing various toxins in the body, including bilirubin, a byproduct of red blood cell breakdown. When the liver's function becomes compromised due to fatty buildup, it becomes less efficient at processing bilirubin, causing it to accumulate in the blood and eventually be excreted in the urine. As a result, your urine may appear darker than usual, sometimes taking on a deep amber or brownish color, similar to iced tea. While dark urine can also be a sign of dehydration or dietary factors, if it's accompanied by other symptoms, such as fatigue or jaundice, it may point to liver dysfunction. If this change persists, it's crucial to consult with a doctor to understand the root cause and prevent further damage to your liver. Number 4. Elevated cholesterol levels. Fatty liver disease is often associated with an imbalance in lipid levels, leading to elevated cholesterol and triglyceride levels. Your liver is responsible for regulating cholesterol levels in the body, and when it becomes overwhelmed with fat, its ability to manage lipid metabolism is impaired. This can result in higher levels of LDL cholesterol and triglycerides in the bloodstream, increasing the risk of cardiovascular diseases such as heart attack and stroke. If you've recently had a cholesterol test and found that your levels are elevated, particularly alongside symptoms like abdominal pain or fatigue, fatty liver disease could be a contributing factor. Managing cholesterol through lifestyle changes, including diet and exercise, and addressing the underlying liver condition are crucial steps in protecting both your liver and heart health. Number 5. Constipation. Constipation is a somewhat underappreciated symptom of fatty liver disease. Your liver plays a key role in digestion, including bile production, which aids in breaking down fats. When your liver becomes overloaded with fat, it can't produce enough bile, which in turn can slow down digestion. This can lead to constipation, making bowel movements infrequent or difficult. Additionally, the metabolic disturbances associated with fatty liver disease, such as insulin resistance, can further exacerbate digestive issues, including constipation. If you've been experiencing ongoing or persistent constipation that doesn't seem to resolve with diet changes or fiber supplementation, it could be worth discussing your liver health with a healthcare provider. Number 6. Mental fog and difficulty concentrating. One of the more subtle symptoms of fatty liver disease is cognitive dysfunction, often referred to as mental fog. When your liver is not functioning properly, it can't filter out toxins from the bloodstream, and these toxins can accumulate in your brain. This can lead to feelings of confusion, difficulty concentrating, forgetfulness, or mental sluggishness. The frustration of struggling to focus can impact your work, relationships, and overall quality of life. While mental fog can occur for a variety of reasons, if it's coupled with other liver symptoms like fatigue or abdominal discomfort, It's important to consider the liver as a potential source of the problem. If these cognitive issues persist, seeking medical advice could help uncover the underlying cause and provide solutions for relief. Number 7. Enlarged spleen. An enlarged spleen, or splenomegaly, can occur in advanced stages of fatty liver disease, particularly if cirrhosis has developed. The liver's dysfunction and the associated increase in pressure within the veins can cause blood to back up into your spleen, causing it to enlarge. This can lead to discomfort in the upper left part of the abdomen, a feeling of fullness, or even difficulty eating. An enlarged spleen can also make you more prone to bruising and bleeding due to its role in filtering blood. If your doctor detects an enlarged spleen during a physical exam, it's important to undergo further testing to understand the cause and manage the condition appropriately. Number 8. Itchy skin. Itchy skin is a lesser-known symptom of fatty liver disease. When your liver becomes damaged and is unable to effectively process bile salts build up in the bloodstream, causing intense itching. This can affect any part of your body, and the itching can range from mild to severe. It may be particularly bothersome at night when it interferes with sleep. Itching is often accompanied by dry skin, and it can lead to visible scratching, which can further irritate your skin. If you experience chronic, unexplained itching, especially alongside other symptoms like fatigue or jaundice, it's a good idea to get checked by a doctor to assess your liver function. Number 9. Nausea and vomiting. Nausea and vomiting can arise when your liver is unable to properly digest food or process waste products. When your liver becomes overwhelmed with excess fat, its ability to detoxify the body diminishes, which can lead to gastrointestinal discomfort. You might feel nauseous, especially after consuming a fatty or large meal, and may even vomit as your body attempts to rid itself of toxins. If the nausea is persistent and occurs regularly, it's important to pay attention to your body's signals. Although nausea can be caused by a variety of factors, when combined with other liver-related symptoms such as fatigue or abdominal pain, it could indicate liver dysfunction. Consult a healthcare provider to explore the potential connection between your digestive discomfort and liver health. Number 10. Ascites. In more advanced stages of fatty liver disease, scarring, cirrhosis, can disrupt normal liver function, leading to increased pressure in the veins that supply your liver. This condition, known as portal hypertension, can cause fluid to accumulate in your abdomen, a condition referred to as ascites. Ascites can result in noticeable abdominal swelling, which may feel tight or uncomfortable. The fluid buildup can also make breathing more difficult or cause a feeling of fullness even if you haven't eaten much. In severe cases, ascites can also contribute to a loss of appetite or difficulty eating. If you experience noticeable swelling or bloating, particularly alongside other symptoms like fatigue or pain, it's essential to see a doctor as soon as possible to evaluate your liver health. Number 11. Jaundice. Jaundice, or the yellowing of the skin and the whites of the eyes, is one of the most noticeable and alarming symptoms of fatty liver disease. It happens when your liver is unable to process and eliminate bilirubin effectively, causing it to build up in the bloodstream. As bilirubin circulates through your body, it deposits in tissues, leading to the characteristic yellow tint in your skin and eyes. While jaundice is more common in advanced stages of fatty liver disease, such as cirrhosis, its presence should be taken very seriously. If you, or someone you know, notices yellowing of the skin or eyes, it's a clear signal that the liver is struggling, and medical attention is urgently needed. In such cases, timely intervention can prevent further complications and improve the chances of better management. Number 12. Fatigue. Fatigue is often one of the first warning signs that something is wrong with your liver, though it's also a symptom that's easy to overlook. Many of us lead busy lives and attribute tiredness to stress, lack of sleep, or overwork. But when fatigue becomes chronic and disproportionately intense, it could be a sign of a sluggish liver. Your liver plays a vital role in producing energy, and when it becomes burdened with excess fat, its ability to metabolize energy is compromised. As a result, you may feel perpetually drained, even after a full night's sleep. The body's inability to effectively detoxify and process nutrients can cause an ongoing sense of weariness. If you find yourself struggling to get through daily tasks or noticing that you're more tired than usual for no apparent reason, it might be time to investigate your liver health. Those were the 12 signs of fatty liver disease. Did you know that fatty liver disease can increase your risk of developing stomach cancer? Check out this video to learn about 12 signs you may have stomach cancer. Thanks for watching. See you in the next video.